A very warm good afternoon to everyone who could join for this session, which we are having today on behalf of Ankura Hospital for Women and Children. I'm a mother myself, and I know that the maximum space which occupies in any parent's mind is my child well fed? Am I able to feed him enough to make him or her strong? So there's something which I realized more ever since I have become a mother, because the discussions with my friends are all about food to children. In fact, even yesterday, one of my friends, we were just messaging of whether they are able to self-feed their child and what foods are best for children and not. So for this important discussion on toddler weaning and nutrition, baby weaning and toddler nutrition, we have with us a senior pediatrician, Dr. Namita Deshmukh, who's also a member of Royal's College of Children and Pediatric Health and practicing currently in Ankura Hospital for Women and Children, Banjara Hills Center. A very warm good afternoon, ma'am, and thank you so much for joining us for this session.
Sure. Thank you, Vandita. Thank you for having me.
So we will kick off our discussion with a very basic query on giving external feeding and for the children for the first time. That's the complementary feeds which is given to the child. So what can be the best food to start with, and how can a parent go about it?
Yeah, sure. So the nutrition for the infants, as we all know that at birth it's breastfeeding and only breastfeeding. So we call it as exclusive breastfeeding, which is the most essential part of the early nutrition for any infant. It should start from birth till 6 months. Previously, there was a window period, some confusion, 4 to 6 months. We can start a little early for working mothers or when there is a problem. But now the new guidelines, as per the all regulations and World Health Organization, also promotes exclusive breastfeeding till 6 months. Why till 6 months? Because most of the infants' nutritional requirements are met with the breastfeeding. But as the baby grows at this time, they need little more nutrition, more variety of food, and only breast milk will not be sufficient. So as Vandita said, most of the mothers are very excited to try something new, try something. What should I feed my baby with? So the answer for the complementary feeding is like, why do we call it as complementary feeding? Because this is going to complement the breastfeeding. So breastfeeding still is one of the important part of the feeding for the young infants. But along with that, we are going to introduce new food to complement the breastfeeding. So when do we introduce it? Is at 6 months. That is after complete 180 days. What is the most important is what food should we start for a baby who is 6 months old? So normally what we advise is the food should be culturally acceptable. So many different societies have different types of cultural norms about how the society eats. So there are few which are like vegetarians, there are few which are vegans, few believe in early introduction of animal food into the diet. So we have to respect all the culturally proven norms and modify the nutrition according to the acceptability of the particular society. So, but it should be nutritionally adequate. So what does nutritionally adequate food mean? So essentially a baby gets breast milk, and the complementary food should have a complete correct combination of the staple, which is the cereals like rice, wheat, ragi, millets, bajra, or it can be tubers like potato and sweet potato. It should also have proteins rich food, like either the animal source food like egg or meat or chicken, or it can be in the vegetarian population, it can be pulses and legumes. As well as for the vitamins and minerals, it should be rich with the fruits and vegetables. So all complementary food should be a combination of all this. So for a baby who is 6 months, when you're going to start a first feed, it can be a homemade porridge, Porridge can be made with the rice. It can be made with suji or semolina. It can be made with the millet or jawar or bajra. You can add external milk or breast milk to the porridge, and you can add some oil and ghee also to make it calorie rich. We will be talking about the calories, how much the baby should be taking and all later. And you can also start giving the baby a pureed or mashed fruit or a vegetable. So something like a ripe banana or a ripe papaya, mash it, make it like a puree, and you can give. So the first food is usually cereal porridge, which is acceptable to the baby, along with some fruit which is introduced. A 6 months baby should usually take around 2 to 3 meals per day.
Ma'am, as you said that these are the meals which are complementing the breast milk. So
Yes.
I just want to ask if there are moms who are not able to adequately breastfeed their children. So is there anything else specifically which they should add to assure that their child is at least getting the required nutrients which they're not missing out because of not being able to feed mother's milk?
So as such, when you start with the complementary feeding, the milk requirement of the baby goes down. The way complementary feeding should be given, give 2 to 3 meals a day and breastfeed as often as necessary whenever the baby demands. If this particular baby or this mother is particularly not able to breastfeed, as it was there was some issue in establishment of the breastfeed initially, then we can use the infant milk substitutes. But as much as possible, please encourage breastfeeding. A baby who is exclusively breastfed till 6 months of age definitely will continue feeding for longer.
Sure, ma'am. Ma'am, also like as and when the parents start, so maybe they're used to eating different cuisines of food and different tastes. They have their own tastes. So if
Yes.
they start giving their food, giving foods to the babies, they may think, oh, is my baby liking this? Is my baby not liking this? I like sweet, so maybe my baby also likes sweet. So they may end up probably sweetening it or putting salt. Or on the
Yes.
contrary, there's also a belief that so many young parents nowadays believe that, so much salt shouldn't be given to the babies, or as long as they turn 1 year, they shouldn't be given any salt at all. So what is the truth behind adding these extra taste to the foods which we give the babies?
Okay. So ideally, if you see, the babies are not used to sweet or salty taste at all. The milk does not have any significant sweetness, neither does it have significant saltiness. And the baby's requirement for the salt are significantly less, like less than 1 gram per day, which is normally met with rest of the fruit, as well as the other complementary feeding itself contains that amount of salt. That's good enough. The other thing is that the kidneys of the infants are not yet mature enough to handle the complete solute load. So significant salt addition to the diet is usually not a good idea, because it can harm the solute load. The kidneys which need to handle increases significantly, as well as there is some future risk of developing hypertension, because the taste buds tend to have salty craving little later. So getting them used to salty diet early in the life is not a good idea. Same thing goes about the sweets also. The milk is not very sweet. It is we who add sweet to make the baby palatable. Once the babies get used to the sweet taste, they start liking that sweet and they kind of start craving for sweets, which can make them problems with future obesity, as well as there can be problems with the dental caries also. We see very significantly often in the smaller infants and toddlers.
Right. Ma'am, another question, as soon as we start giving external food to our children, is whether they have eaten well or not. Like, how much food do I give my baby? So the other day I was discussing with my mother, and she said that, some of my aunts in the past, they used to feed their children till they vomited. So on contrary, with me, it's like I have a small stomach. So if I feed my child 1 spoon extra, I always feel, oh, am I feeding him too much? So is there a way to assess what's balanced?
Yeah. The way you said small stomach, that is important. We call it as a stomach capacity. A normal infant has a stomach capacity somewhere approximately up to 30 meals per kg. So suppose if a baby is 6 kilos, so 30 meals per kg. So baby has approximately stomach capacity of 180 ml of the total diet plus water which goes along with it. The stomach emptying time, like previous feed gets emptied somewhere between 2 to 4 hours, depending on what the feed was given. For liquids, it is early. For the solids, it is a little later.
Right.
So the stomach has to be empty completely, and then you give 180 ml per meal, but this approximately. So normally a 6 to 8 months baby should eat approximately half a bowl, and a 9 to 12 months age baby should eat approximately 3/4 to 1 bowl of a normal around 200 to 50 ml bowl is what we usually call.
Okay.
And also go by the satiety cues what the babies give. So there are some hunger cues and satiety cues. These are the small gestures what the babies show usually when they're full, that they kind of refuse. They move away from food, that I'm full, I don't want anymore is what they want to convey. They kind of feel relaxed.
Right.
So these are the cues you should actually respect. So feed the babies as per the satiety cues. You again are going to feed them in 2 to 3 hours time. Do not feel, oh, I made it with so much of efforts and my baby is eaten only half of it. What should I do with the remains? Do not worry like that.
Okay. Okay, ma'am. And as the baby starts growing, like when they enter the toddler age, they don't want to sit at a one place. They are just running around. They may become like difficult eaters. And
Yes.
similarly, as they grow more and, maybe cross 1 year, they may even be picky eaters. So is there any a way to, handle such situations if parents face as the baby grows up?
Yeah. So as you say, they start getting mobile and then they're kind of more interested in excursions rather than actually the food. The babies have a rapid growth rate in the first 1 year of age. As you see, they start growing rapidly. They go through significant changes. After 1 year, the growth slows little so that their appetite is variable depending on the activities rather than much of the growth. So it can vary from day to day also, as well as they want to explore things. So introduce variety in the diet, encourage a self-eating habit. Let the baby explore the food. Let the baby play with the food. Let them mess with it. It can be a finger food or it can be a spoon feeding. Let the baby hold one spoon of himself and dip it in the bowl and try eating. You can have another spoon with you and try feeding him with another spoon, or fill up the baby's spoon and help him feed. So self-feeding goes, it needs patience, it needs time, but it helps in avoiding the future feeding conflicts and future feeding behavioral problems.
Right, ma'am. So self-feeding can start at approximately a year?
Self-feeding can start somewhere around 8 to 9 months when the baby is able to hold the spoon in his hands, and when the pincer grasp comes somewhere around 8 to 10 months.
Right.
Yes.
Ma'am, then is there anything as much as we want to feed our children well, can there be something which like a child can be predisposed to obesity because of the food that he's having and in the initial years of life? Though this is something that comes last in our minds, but this is something which can form a significant portion of how they are developing up in future. So are there any things that should be taken care of when we are feeding our children initially?
Yes. Actually, yes, we're seeing that the infant obesity or overweight is being significantly increasing over a period of days. In fact, few developed countries have infant obesity rate of somewhere around 8%, which is significantly high, because we know an obese child grows as obese adult. It is very, very difficult to control obesity later in life. So it is very important that we should respect the baby's satiety cues. Do not override baby's satiety. So when baby feels full, avoid feeding the baby. So most important is overfeeding should be avoided. What is happening more often is we are giving distractions to the children. They're watching videos or playing something, and we keep stuffing semi-solid food into the mouth. And the baby satiety cues are kind of disturbed. They are not conveyed, or the parents are not bothering about it. So avoid overfeeding in those terms, as well as avoid making the food very calorie rich. So as we discussed, the nutrition should include everything. It should include fats, it should include the staple fibers, proteins, as well as fruits, vegetables for minerals and vitamins. If there is more of fat and the sweetener like sugar content, some amount of sugar for the weight gain purposes can be added to increase the calories. But definitely more amount of sugar plus fats can rise to the obesity.
Ma'am, instead of sugar, is jaggery or honey a better option, or these are just beliefs?
Jaggery can help with some iron enrichment of the food. Honey is usually avoided in children less than 1 year of age because of some risk of infections.
Right.
But actually the natural sweeteners like fruit purees or date syrups or mashed and pureed dates are definitely much more preferable because they will increase the nutritional value of the food along with making it sweeter or palatability increased.
Right. Ma'am, just like allergies to normal other things like metals or what we wear, can there be food allergies also? And if so, in a baby, like we don't know whether a food will be allergic or not. So are there any foods which are more prone to cause allergy? And if so, how can a parent identify it or go about introducing it to the child?
There are definitely known food allergies. The common food allergens are cow's milk itself. Then there are many different nuts which the children can be allergic to. Common is peanuts allergy or almonds, most of the nuts. There can be allergy to the seafood, fish. There can be chicken egg allergy also. So all of these, if the allergies are known in the family, definitely for that particular infant, these introduction of these food should be delayed. Like cow's milk protein should be tried only after 1 year of age. The nuts should not be introduced all in a one go. It's like not to grind all the nuts together and make a paste and give to the child rather than try each nut separately, definitely in a pureed form rather than giving the whole nuts because they can have chokings with that. Yeah. But if there is no known allergy into the family as such, there is no harm in trying these food varieties into the early in the life, somewhere around 6 to 9 months. See if the baby develops allergies to them. If there is no, they can continue. The allergies are usually manifested in the forms of vomiting, diarrhea, or significant colic. There can be some skin rashes also.
Ma'am, parents also in general, like this is a general question that, we like when we talk amongst our friends, they focus more on feeding more nuts, more like fruits, fancy fruits like avocados. So if you talk to newer parents, they'll be talking lesser of the dal rice and chapati, and they'll be talking more of the pear and the avocado and some fruits, which I have to Google. So, so.
It's not necessary. That's why the first thing what I said is culturally acceptable. So right. The local food, which you just need to balance the nutrition completely. It is not that avocado is superior to some fruits what we have grown locally. Find the nutritional values of the diet and then give accordingly. You right. don't have to buy specifically avocados which you don't know how they've been preserved and when they've been actually cultivated and which countries and transported for all this.
Right.
Prefer local, buy fresh, cook fresh, and give to your child.
Ma'am, yeah.
Yes, go.
Ma'am, someone from the audience has asked for a diet plan for a 2-year-old. It's Shravi Karthik. She wants to know the diet plan for 2-year-old, a rough plan if you could.
Okay. So approximately a 2-year-old child should have 3 to 4 solid meals a day, along with breastfeeding if she's continuing, because the current norms for breastfeeding is 2 years and beyond. Continue breastfeeding if you can, but at least till 2 years. 3 to 4 solid meals should be table family meals at 2 years of age. So it means that whatever the parents are eating, the same food the child should be able to eat. By 2 years, they should also be able to chew and eat. Do not give them pureed or mashed food at 2 years of age. It can be associated with 1 or 2 snacks in between. The snacks are usually easily made finger food, which the child can eat by himself. For a 2-year-old, it can as well be a cut fruit, or it can be a vegetable like boiled potatoes, or it can be a milk feed also if the mother is not breastfeeding.
Right. Ma'am, how much milk otherwise can be recommended for a like 1 year plus child? Like, because when they are trying to, switch the, more to solids and lesser to the milk, then how much should they cut down on?
Again, we talk about breastfeeding. Continue breastfeeding till 2 years and beyond. And as long as the breastfeeding is continuing, you don't need any outside milk intake.
Right.
But if for some particular reason it is not being given, then
Right.
the milk intake in a day should be somewhere around 400 to 600 ml. It should not exceed 600 ml.
Okay.
Because again, there are few nutrients which are not there in milk, like iron, which the child can have significant deficiency of later.
Ma'am, also, ma'am, since we're talking about breast milk, sometimes, babies get dependent on breast milk so much so that they continue to, latch the mom till, even if they're trying to wean off the child. So, and they're more interested in mother's milk than solid foods. So, because of convenience. So, how can a mother handle that? And is there a way to, wean them off when they're trying to and the baby is not weaning off?
Okay, weaning them off is just separation of the mother and child for that particular time when the child is demanding, and someone else can take care of the child for that particular time. So suppose this is a specific meal time which the mother is trying to feed the child, and child is asking, I don't want to eat khichdi, I want mother's milk. Though not specifically in the words, the child is kind of giving the cues of that. So what she can do is make the child not sit on her lap, but make him sit in front of, so in a chair, and she can face the child from opposite and try feeding, so that he gets a clear cue that yes, I'm not going to breastfeed you, this is what you're going to eat. And then feed the child, tell them stories, talk to them that this is the age when most of the children by 1 year start understanding that you are a big one, you should start eating. And if nothing is helping, ask somebody to help you out feeding the child for that particular time, so that the mother is not in the vicinity and child gets to know, yes, this is what I'm going to get, I'm not going to get breast milk at this time.
Ma'am, someone from our audience, Bhanu Ashireddy, so they want to know that if the child is not taking milk, then what can they do, and can there be a rough diet plan that you can tell which they can follow for a 6-year-old child? And if they're not taking milk, so is there any other option? That's what they want to know, to give that.
Okay. So milk, if it is not being consumed in the form of a milk, you can give them in the form of a yogurt, you can like homemade curd, or you can give them in the form of a cheese or paneer, which is again everything to do with the milk in a different form. And most of the children tend to consume that in different formulations, because milk is a good source of fat as well as proteins as well as calcium, specifically for the Indian vegetarian population. So in any of these forms, if it is given, that's sufficient enough. If the child, some children, suppose somebody has a milk allergy and they're not able to consume milk, then we tend to give them prescription, like advise them for the other food content which are more rich in calcium. Something like ragi is a millet which is rich in calcium. So if the child is not able to consume milk, give them proteins with millets, calcium with ragi and other calcium rich food, and other that should suffice.
Ma'am, okay, ma'am, so again, ma'am, the 2-year-old mom, she wants to know what are the varieties that we should give our 2-year-old baby, and how many times can we give breast milk?
Breast milk? As often as...
times, and the varieties of food, that's what she wants to know.
Okay, the varieties of food, as I say again, you can give the normal family pot. Like you made idli, dosa, pongal, upma, poha, whatever for your breakfast your child should be consuming. Maybe the spices you can adjust as per the child's liking and as per the child's palatability, but you should be definitely be giving that. Then the meal should be rice, dal, plus a vegetable and curd, or it can be a roti, or it can be paratha, depending on whatever is routinely consumed. The same thing. So there are 3 to 4 meals a day, as I told already, plus 1 or 2 snacks. The snacks can also be whatever is being given. Like I said, it can be a fruit, it can be a small vegetable which is cooked, or it can be some sprouts. So whatever according to the child's like, and it can be a milk also. Breastfeeding as often as the child demands, specifically during the night time. as well as while the sleeping in the daytime also.
I'm talking so much about food, like food is all about, whether my child is growing well or not, whether the child is adequately nourished or not. So, what I want to sum up with it's how can a parent assess whether their child's growth is good, and are there any warning signs wherein, they may notice and they can meet the doctor, to assess that, like, yeah, the growth's not fine. And this is at this point in time, I should consult the doctor. The weight is not well, or for overfeeding. So what is your advice on that?
So normally a baby grows twice the birth weight by 5 months of age and 3 times the birth weight by first year. In the first few months, the babies gain approximately 800 to 900 grams, so little less than 1 kilo per month. So every time you go to the hospital, go to doctor for vaccination, you will notice that every month the baby is increased this much. So once in a month, weight check is needed for first 3 months. After that, we can reduce the frequency of the weight check. And there is also something called as growth chart, which most of the mothers must be knowing about. So growth chart is a chart which is devised compared from significant data from normal population, in which there will be lines on which your baby's weight will be plotted per visit, and it will be seen whether the baby is growing as per the growth norms or not.
Right.
If there is a dip in the growth chart, so previously a baby was following a particular line of 50th centile, and now suddenly in the last 3 months, baby's weight is fallen down 2 lines and it has come to the bottom line. That means that baby is not been gaining weight as what he was gaining or what he should be gaining, and you need to see a doctor about it. Same way, if the baby is going higher into the lines, so suppose from the normal average is what we call as 50th. If it is going up to the 90th lines, then it means that baby is gaining weight significantly more than what he or she should be gaining, and you need to talk to doctor about the increased weight gain. So growth charts are the best tools to assess the growth of the child over a period of time and follow it over a period of time too. So I think all the mothers should know about growth charts little. They should talk to their doctors about it at the vaccination visits, and then learn about it so that you can monitor the child's growth yourself.
Thank you so much, ma'am. It was so valuable. If there's anything that you would want the new parents or parents dealing with babies and toddlers right now to know more about nutrition, then probably we can.
I think most important is that do not be stressed about feeding a child. The feeding times are the happy, loving, and learning times. So I know it needs patience. I'm a mother of 2, so I know how it goes. But be patient, talk to the child, keep feeding them lovingly, and more than making them eat, encourage them to eat. So that you should employ different methods of encouragement if a child is not eating very well of the same particular food. And more important about introducing of lumpy food. So what happens is we are seeing a lot of picky eating habits, or there are a lot of complaints that my child is not able to eat the lumpy food. Even at 2 years, people still use mixie to make it paste, which is not a right way of feeding a child. Let the child feed on their own. And introducing of lumpy food, a critical window, what we say, somewhere around 9 to 10 months. So start introducing lumpy food little early at 9 to 10 months so that the child does not continue to be picky over a period of time.
Right. Great. Thank you so much, ma'am, for giving your valuable time and for this wonderful discussion. I'm sure a lot of parents would have benefited. And thank you, Ankura Hospital for Women and Children, for having organized this session.
Thank you, Vandita.
Thank you so much, ma'am.